Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home-related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar is Best Practices for the Respiratory Season. Everyone has entered the meeting on mute, but we will have a Q&A following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is flu and source control. If you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our speaker today, Jennifer Brown. Jennifer is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 10 years of experience in a variety of healthcare settings, most recently as Director of Staff Development and Infection Prevention in Long-Term Care. She has led several quality improvement and infection control initiatives in acute and ambulatory settings. Jennifer, thank you for joining us again today.
Thank you, Kathy, and good afternoon, everyone. Thank you for joining us today. As we gear up for another respiratory season, you know how crucial it is to keep our nursing homes safe and healthy. It's not just about protecting our residents, it's about safeguarding our entire community, including our staff, visitors, and everyone in between. In today's session, we're going to dive into best practices for the upcoming respiratory season to help you prepare for the challenges ahead. So whether you're a seasoned pro or new to the world of healthcare and nursing homes, we'll explore things to consider this respiratory season, including vaccination programs, outbreak management, and other issues to help ensure our team stays strong and motivated. Although we'll cover a lot of information today, I'd like this to be a conversation, a chance for us to share ideas and learn from each other. So we're going to start off by getting to know each other. We have a pre-test that we're going to launch now, just to, look at how familiar everyone is with the respiratory viruses. Great. Thank you so much, everyone, for filling that out. And we'll revisit that a little later in the presentation as well. Okay. So first things first, let's discuss respiratory illnesses in nursing homes. Respiratory illnesses are common, but can pose significant challenges in nursing homes. However, with the right knowledge and strategies, we can manage and mitigate their impact effectively. So let's talk about some of the common viruses seen in nursing homes. Respiratory viruses can spread quickly and have serious consequences, especially among elderly residents with weakened immune systems. Three of the most common viruses we see out there are influenza, RSV, and COVID-19. Influenza is very well known and can affect people of all ages, known for causing seasonal outbreaks, especially in the fall and winter months. It's a virus that spreads easily through coughs and sneezes, making close quarters like nursing homes particularly vulnerable. In addition to its ease of spread, influenza also impacts nursing homes because adults over 65 are at higher risk for developing some of the more serious complications like pneumonia. Some of the symptoms you might see with the flu include cough, sore throat, runny nose, fever, and this is something to particularly look out for because older adults don't always have the high fevers you look for with the flu. It might just be an increase over their baseline, so just monitor that really closely. Some other things you might see are headache, chills, and fatigue. Antiviral drugs are available for flu, but they have to be used early in order to treat it effectively and lessen the chance of serious illness. RSV is often associated with young children, but it can be quite dangerous for older adults over 60, especially those with chronic health conditions. RSV season generally starts in the fall and peaks in the winter. And this is also a virus spread through droplets when an infected person coughs or sneezes. The symptoms are very similar. They can be pretty mild, but in older adults can be a little more serious. Some of the things you might see are runny nose, decrease in appetite, coughing, sneezing, fever, wheezing. In older adults, RSV can cause significant respiratory issues like pneumonia, which can be life-threatening for those with underlying health conditions. And it can worsen conditions like asthma, COPD, and congestive heart failure. COVID-19 has dramatically reshaped how we think about infection control and outbreaks in nursing homes. And it not only spreads rapidly, but also impacts our population at a higher rate. It also has a higher risk of severe outcomes for older adults, especially those with comorbidities. Some of the things you might look out for with COVID-19: fever, cough, shortness of breath, sore throat, congestion, a loss of taste or smell, and fatigue. And as you can see, these symptoms are similar to other respiratory viruses, and that's why prompt identification of the infection through testing is so important. There are treatments available, but treatment must be started within the first 5 to 7 days after symptoms start to be effective. So together, these three viruses highlight the importance of, really stringent infection control practices, vaccination programs, and early detection in order to protect our residents and staff. And understanding how these viruses behave and the best strategies to prevent the spread is key to keeping everyone safe. Pneumonia is another infection that we see commonly in nursing homes. It's a serious lung infection that can be caused by a variety of pathogens and can be caused by viruses if it progresses. But in nursing homes, the most common cause of pneumonia is from bacterial infections. One of the common bacteria that we see it from is strep pneumoniae. The symptoms of pneumonia can vary depending on the cause, but typically coughing, fever, chills, shortness of breath, chest pain, fatigue. In older adults, these symptoms might be less obvious and can include confusion or a noticeable decline in physical function. And these symptoms can be particularly severe in elderly individuals and those with chronic health conditions. And again, that's why that prompt recognition and treatment is crucial. For transmission, pneumonia depends on the underlying cause, but bacterial pneumonia often spreads through direct contact with respiratory secretions, like when a infected person coughs, or in a nursing home setting at close proximity to other residents, and the shared spaces sometimes may assist with transmission. Preventing pneumonia in nursing homes involves really good combination of vaccination, good hygiene practices, and quick isolation if necessary. So the best way to avoid all of these illnesses is to prevent them from happening. Fall immunization programs play a crucial role in disease prevention, especially in nursing homes where residents are particularly vulnerable to respiratory illnesses. And as we head into the colder months, the risk of outbreak increases, making timely immunizations a key strategy to protect both residents and staff. But regardless, it's really important to keep these fall immunizations at the forefront of our minds. Staying up to date with immunizations is so important for a lot of different reasons. Number one is disease prevention, making sure that residents are protected from contracting the disease, which leads to overall community immunity and the prevention of outbreaks. It also protects vulnerable populations and, helps public health and healthcare system resilience. So there have been several updates to the fall immunization schedule, included updated recommendations for COVID-19, influenza, RSV, and pneumococcal vaccines. So we'll first start, we'll talk about COVID-19 vaccinations. With the ongoing presence of COVID-19, vaccination is always a hot topic in infection control programs. So staying up to date with vaccines, to maintain immunity against severe illness is particularly important for those at high risk for infection, such as the elderly population that we serve. There have been some updates to the recommendations. A new 2024-2025 vaccine has been approved by the FDA and is available now. This year's formula targets the currently circulating JN1 and KP2 Omicron variants. Everyone age 6 and older should get an updated 2024-2025 Moderna or Pfizer COVID-19 vaccine to be considered up to date. The Novavax is no longer available, but they are looking at their approval as well. But for right now, the Moderna and Pfizer are available. For those adults who are unvaccinated or those who were previously up to date, it's recommended to receive the updated 2024-2025 vaccine at least 8 weeks after the last dose. For influenza vaccination, it's another cornerstone of infection control programs because the flu can cause severe complications in older adults, including pneumonia, hospitalization, and even death. By vaccinating residents and staff, we can significantly reduce the incidence of flu in the facility, lowering the risks of outbreaks that can overwhelm the healthcare team and put residents at serious risk. The CDC recommends the influenza vaccine for everyone 6 months of age or older, with rare exceptions. The 2024-2025 flu vaccines will all be trivalent formula and will protect against the H1N1 variant, H3N2, and B Victoria lineage virus. For adults, especially those ages 65 or older and pregnant women in the first and second trimester, vaccination in July and August should be avoided unless it won't be possible to vaccinate in September or October. And this is because the protection may decrease over time, and you want to make sure that residents are protected during peak flu season. Next, we'll talk about pneumococcal vaccination. That's another important vaccine in nursing homes. It's a common, pneumococcal disease is a common cause of pneumonia, bloodstream infection, and meningitis in older adults. And this vaccine is often administered alongside the flu vaccine during the fall, providing broader protection against respiratory illnesses. So this is the current pneumococcal vaccine schedule that I have pictured here. This includes the PCV20, which is a one-time dose, or other prescribers may opt to administer the PCV15 followed by the PPSV23 vaccine for those who are not vaccinated. So there will be updates coming soon. The pneumococcal vaccine recommendations have been updated to recommend the PCV21 for adults as of June 27th of this year. And this vaccine is approved by the FDA and targets Streptococcus pneumoniae strains that are common in adults. The PCV21, it's not just a PCV20 with an additional strain included. It includes 11 serotypes that are not found in the PCV20 that cause disease in adults. The PCV21 will be administered as a single dose, just like the PCV20. And after it's administered, no further pneumococcal vaccine doses would be recommended. The official CDC vaccine schedule is pending update, and to my knowledge, although it's approved, it's not available yet. You guys let me know if you've seen it available out there in your area. But I've been checking in, asking around. I haven't seen it yet. Some strategies for integrating pneumococcal vaccines into your routine clinical practice. It's essential to ensure that eligible individuals get this important immunization. Some ways to incorporate that into your practice and workflow is to do a resident assessment on admission. Put in reminders in the electronic health record when doses are required. Do facility vaccine tracking. This can be done in paper form in your electronic health record, or Quality Insights does have a vaccine tracking worksheet to assist you with this, to coordinate with other vaccine programs. And by implementing these strategies, healthcare organizations and clinical practices can make it a routine point of resident care and reduce the risk that doses are missed. Next, we're going to talk about RSV vaccines. RSV vaccines have been approved for older adults and become an important part of the immunization efforts. RSV can cause serious respiratory infections in elderly populations, and the vaccines help to prevent these infections from taking hold of, nursing homes and causing serious outbreaks. The CDC recommends a single dose of the RSV vaccine for adults 75 and older, and for adults 60 to 74 who are at higher risk for severe RSV disease, it is also recommended for them. This is also a single dose vaccine. The RSV vaccines are available and covered by most private health insurance, and also through Medicare Part D and Medicaid at no cost. So we've discussed how important vaccines are. Let's talk about how to get vaccines to those who need them. Planning for vaccine clinics in nursing homes is a vital part of protecting residents and staff during the respiratory season. A well-organized clinic ensures that everyone receives their vaccines in a timely manner and that it's efficient and it's done safely. Ensuring that vaccines are readily available is the first step in planning a successful clinic. Collaborating closely with vaccine suppliers is essential to secure the necessary doses. It's important to communicate your needs early, especially for high demand vaccines like those we talked about today, such as flu, COVID, RSV. And establishing a strong partnership with pharmacies can also help with scheduling deliveries and managing any supply chain issues that might arise. You also want to make sure that you have the necessary supplies on hand. You want to gather all syringes, alcohol swabs, bandages, anything you might need to run your clinic. And don't forget about PPE, gloves, masks, things like that, that might be used during the clinic, and also your emergency kit that might include any emergency meds, stethoscope, blood pressure cuff, to have on hand in case complication does arise. And this will ensure that your clinic is managed safely. You also want to make sure competencies for your staff are up to date. It's essential to make sure that they not only know how to give the vaccine, but also understand the specific protocols for each type, the handling of the vaccine, any potential adverse reactions and how to manage that. And by using regular training sessions or refresher courses, it can help keep the skills sharp and ensure everyone is confident in their role. Some things you might want to cover are vaccine storage and handling, including temperature requirements, proper vaccine administration techniques, such as injection site selection, needle length, the importance of documentation, documenting the proper vaccine doses and any adverse events that might happen, and also managing common side effects. Some strategies that might help with promotion. Promotion is another important aspect leading up to your clinic. Some things to consider to engage residents and staff are the use of visual aids, adding posters in the common areas with information about your vaccine program, which vaccines are offered, when it's going to be offered. Consider adding infographics, other printable resources that might help with educating residents and staff. Be sure to highlight benefits of vaccines, stressing the importance of prevention, share positive experiences that you've had with vaccines, and consider using peer ambassadors, other trusted health care workers or other residents who have had positive experiences with vaccines and are willing to share their experiences with others. There'll be times when residents and staff are hesitant to accept vaccines. And if this happens, communication is key. Making sure to utilize effective communication strategies such as active listening, empathy and respect, answer questions if any questions come up during the conversation, providing accurate information from reputable sources, and discuss risks and perspective. Some other approaches to address vaccine hesitancy are, addressing any myths that the person might have by providing evidence-based information, addressing the myths directly, using trusted sources, utilizing cultural competency, and listening and empathizing with them. During this time of increased respiratory illnesses, it's also important to look at the infection control measures at your facility. To help reduce the spread of infection, consider implementing rigorous hygiene protocols such as hand washing and PPE use. Environmental cleaning and disinfection practices should be intensified, focusing on high-touch surfaces and common areas, and educating staff on these precautions because they ensure that they're consistently and correctly applied. Also, managing mask usage and respiratory hygiene amongst residents and staff, making sure everybody knows their role in the respiratory hygiene program, and also environmental controls. Take a look at the environmental controls at your facility, such as your ventilation, air purification that you have installed, and any regular disinfection protocols that you have. This is also a good time to look at your facility's visitor and staff policies to ensure that they're meeting your needs. Review screening and monitoring protocols for visitors and staff, and policies on visitor restrictions during peak virus season. Also, training staff on updated infection control practices. Even with the best, prevention protocols that we have, outbreaks still do happen. So early detection of outbreaks is key to control. It involves continuous monitoring of residents and staff for symptoms of illness, such as fever, cough, shortness of breath, and having a system in place for rapid identification of symptoms in your resident population, which will allow for immediate isolation. And that's a crucial step in preventing the virus from spreading. Isolation should be done in a dedicated area away from non-affected residents with clear protocols for the use of PPE. And that early identification and isolation can significantly reduce transmission. Residents and staff with signs or symptoms should be tested, even if they've been vaccinated. There might be pathogens of concern in your area, So, test for those if you have flu circulating or RSV circulating, COVID. But also consider respiratory pathogen panels that do test for multiple illnesses, because that can be an issue during the fall and winter months. Transmission-based precautions such as hand hygiene and the use of gloves, gowns, masks, and eye protection are also very important during outbreaks. Ensure that you have proper levels of PPE stocked and ready to go in case the outbreak does occur. If you do have a confirmed case, like I said, I'll isolate as soon as possible to stop the transmission. And if you have more than one confirmed case, you can consider cohorting residents. Cohorting involves grouping residents based on their infection status to prevent cross-infection between those infected and non-infected individuals. And usually there's 3 groups involved. You have your infected group, your negative but potentially exposed, and those unexposed and negative. And each group should have separate areas where they can isolate to minimize cross-contamination. The creation of these cohorts requires really careful planning and might involve reassigning rooms and sections. So please take a look at your cohorting plan now. You do not want to wait until a resident tests positive to try and figure this out. Every facility's plan for cohorting residents is going to look different and depends on a lot of different factors. Some things to consider are the size of your facility, the layout of your facility, the population that you serve. And if you're having trouble with your plan, consult with your local health department, because they can really help out with helping you plan out, how that will be. This is a copy of a Quality Insights resource that can help with cohorting. It might assist with making decisions with, which residents can cohort together. This is another table that might be helpful when you're looking at your testing protocols. During outbreaks in a nursing home, effective coordination and communication are critical to managing the situation. You want to coordinate with local health departments. These agencies provide guidance on best practices, testing protocols, and other reporting requirements, and establish a direct line with them to get updates on recommendations during the outbreak, and update them on the outbreak status. Communication with medical staff is also really important, providing that clear and consistent information about the outbreak. And also, last but not least, communication with frontline staff. Frontline staff is your backbone of your outbreak response efforts, so keeping them informed is vital. They need to understand the specifics of the outbreak and what symptoms to look out for, the procedures for reporting suspected cases, and things like that to ensure a good management of the outbreak process. Also, keeping residents and family members informed about your outbreak is crucial for maintaining trust and ensuring safety and reducing anxiety throughout the outbreak process. And effective communication should address 3 main areas: your outbreak status, prevention measures, and visitation recommendations. So provide that regular update about the outbreak and, keep the families informed. Your prevention measures, clearly explaining that prevention measures can help residents and their families feel more safe and, understand better why certain policies are in place, and, understand their role in, the use of PPE, the use of respiratory hygiene, and any restrictions on communal activities and things like that. And also visitation policies that might need to be adjusted during the outbreak, and provide detailed guidelines on safe visitation practices, such as wearing masks, practicing hand hygiene and maintaining physical distance. And also alternatives for visitation, such as video calls for people who might be at high risk. So those are all things that can help with the outbreak response and managing things effectively. Having these multiple streams of communication, whether it be through emails, newsletters, bulletin boards, can get the information out and make sure that everyone knows their role in the process. At this time, I have a few knowledge check questions that I'll ask you guys to complete. Please complete those. We'll just give you a couple minutes. And then if anybody has any questions about anything that was covered, you can take yourself raise your hand and take yourself off of mute or put it in the chat. Great, thank you everyone for those questions. This page is just some resources and continuing education that might be helpful as you are doing your vaccine programs. It has some information from the CDC, immunize.org, our Quality Insights vaccination page, and the You Call the Shots web-based training course for vaccines. And as I mentioned, we were going to circle back with the post-test. I'm not sure if we're able to go over the answers of the knowledge check questions, but I'll just go over them now. Number one, we have which common respiratory infection is not caused by a virus? And the answer to that one was B, pneumococcal pneumonia. Number two, which of the following is most effective method for preventing the spread of respiratory viruses in nursing homes? And the answer for that one was C, vaccination programs. Remember, prevention is key. Number three, which of the following is a common early sign of respiratory infection in elderly residents? We had A, fever, B, cough, C, shortness of breath, and D, headaches. And while all of them can be signs of many of the respiratory viruses and bacteria that we talked about today, cough is the most common early sign and usually a symptom of all of the four that we went over today. Number four, when managing an outbreak, what is the first step you should take? And the answer is A, ensure to isolate the affected residents. That early identification and isolation is key. And number five, how should nursing home staff effectively communicate with families during an outbreak? And the answer was B, providing regular updates through emails or newsletters.
And Jen, did you have anything else to add before we wrap up today?
No, I would like to, again, thank you all for attending today's webinar. I hope you found it helpful. And if you have any questions or concerns or anything that you think of after the webinar has ended, please reach out to me anytime. My email address here is jbrown@qualityinsights.org, and I will share my contact information on the screen. Have a good day, everyone.
All right, thank you, Jen. Before we sign off, we'd like everyone here to please answer a short evaluation of today's webinar. It's anonymous and will show us a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Jennifer, thank you for joining us today. And we thank everybody here for joining us today. And we hope to see you again next week.
Thanks.